We went back to the literature to look at the summaries of studies that were done, and the most recent study was 1980. And if you look at the detail, there are 24 people put on a low-carb diet. In fact, they all lost weight and the triglycerides fell, but there was this pesky little rise in LDL, which then they thought would mean that everyone would, have heart disease, and it was a terrible. It was like actually prejudgment on change in LDL cholesterol, but that's going to ring true in the cholesterol class, right? Because there are so many people still focused on the LDL. I just kind of have to chuckle because, by today's standards, a study with only 24 people in it, which is not randomized, it's not a large enough study to make any sort of policy decision by any means. But what it did is that it made it taboo or an unwritten rule that you couldn't study or use low-carb keto diets. So 20 years later, when my group at Duke and Jeff Volek's group started studying the low-carb diet, and we did it because we were concerned about the safety as well. But we broke this taboo thing. It's give me 50 people, follow them over 6 months, publish it in a peer-reviewed journal, studying everything you can about their health. So, and then many more studies have been done since that time. It's gotten to the point where actually the low-carb diets and keto diets are the most studied diets, even though Gary Taubes, Nina Teicholz were also very important in kind of relearning that low-carb diets were used for obesity since 1863, and low-carb diets were actually used for diabetes since the 1920s in this textbook. And as we got into this and doing our own research, learning that the low-fat diet was not founded on great science, the whole idea of eating fat being bad was not very scientific, if it was scientific at all. Learning that actually these diets were commonly used before the whole 1970s, 80s sort of debacle against eating fat. So now I can confidently say that low-fat diets are not science-based. High-fat diets are science-based, and there are actually guidelines now, therapeutic guidelines in the Obesity Medicine Association, the American Diabetes Association, and the Society of Metabolic Health Practitioners have guidelines that show how to use therapeutic carbohydrate restriction, which is the technical term for low-carb diets, how to use them safely. Happy to be on the covers of Woman's World. And here on the far right in 2021, I started using the term prescription strength keto. And if this plan were a drug, it would be approved by the FDA. So I teach a evidence-based and prescription strength keto. And I'm going to go through two cases here. This is a 43-year-old female with a body mass index of 55 kilograms per meter squared. So she's weighing over 300 pounds. She came to the hospital for acute systolic heart failure, meaning a sudden onset of heart failure with shortness of breath and liquid building up in the lungs called pulmonary edema. She had an implantable defibrillator placed. This is kind of a common thing that happens now. And there are medications being used for this. And she was being treated, discharged from the hospital with improvement, but still, was overweight and had symptoms of heart failure. So she learned that her father was doing a keto diet. And I have to just say that the word of mouth spread of this is common and extremely important. So she did some internet research and started using a keto app and tested her urine ketones and was using a keto diet on her own. And she lost 15 pounds over 12 weeks, which is fantastic. So she initially lost weight, but hit a plateau and then came to see me at the keto clinic. And her ejection fraction, EF means ejection fraction, that's the amount of blood that's squeezed out of the heart with every heartbeat. And she had severe heart failure with only a 20% ejection fraction. The keto diet was started under my supervision some months later, but she then lost weight after another 10 months or so, down to a BMI of 33.5 or a weight of 180, and her ejection fraction went up to 50%, which means almost a normal squeezing heart. So this is serious heart failure, life-threatening, needing hospitalization. Of course, it took time for this to happen, and of course, you need to learn from someone who knows how to do this safely, with a doctor who knows how to help you adjust medications. He's 5'2" and still weighs about 160 or 70 pounds. But she's tickled, she's thrilled. She has her own Instagram channel now talking about this. The second case is a 62-year-old male with a similar story of having heart failure. And he did not grow up heavy as a child. He got a weight problem about the age of 48. The most he ever weighed was about 353. He thought weight gain was a result of lack of exercise and eating. Never really heard of a low-carb diet before, and he had never used medications or very low-calorie diets. These are diets you can buy from the doctors. He never used weight loss surgery. He had been minimally active, and an important point there is you don't have to exercise to lose weight. People come to me and they have no energy most commonly, and this still will work for them. And he was a police officer, retired for several years now. So on his ejection fraction, he had a reduction down to, again, about a 20%, and was increased now to about a 40% ejection fraction. And this just shows his weight trajectory going down over time. Interesting to note that he was sent to the keto medicine clinic by a cardiologist. So, yes, heart doctors, cardiologists are open to the idea of using a keto diet, and you can see that his weight has come down over time. He's still on medications there on the far right, and it's just an important reminder to do this with a physician or medical person who is comfortable using this kind of approach. What does the heart use for energy? What fuel does it use? This is a recent study that basically shows the heart uses fat for fuel. And the pie chart here, the gray and the yellow really comes together like this. FFA means free fatty acids. On the normal heart on the left, the 85.9% of the heart energy was derived from free fatty acids, from fat. So the heart muscle uses fat for fuel, 86%. You can see at the very bottom, so ketones, 6.4%, amino acids or proteins, 4.6%, lactate, 2.8%. Other is less than 1%. Other includes sugar. And it doesn't even show up on this pie chart in the normal heart. Now, in the heart and heart failure, there's a little more use of ketones, a little more use of lactate and amino acids, but there still is the majority of the energy used by the heart muscle is fat, the free fatty acids. This makes sense because fat carries the most energy in the molecule, most energy per gram. Now, this is not common knowledge among cardiologists. In fact, in the 2020, the people who did this paper writes here, the heart primarily consumed fatty acids, and I underlined it, unexpectedly little glucose. The heart has always used fatty acids. It's just showing that the cardiology world and these researchers just were not paying attention to the physiology anymore. And I think a lot of this was a problem with the idea that the epidemiologists said eating fat was bad for you, or the physiologists have known for a long time that heart muscle actually uses fat and prefers fat energy over glucose. So I'd just like to briefly show that there was an old paradigm view, even for heart failure research. There's an old paradigm view in terms of the blood cholesterol. There's an old paradigm view in terms of eating fat. And it was thought that the heart needed more glucose, more sugar. In fact, studies were done to infuse, meaning giving intravenously glucose and insulin during myocardial infarctions, during heart attacks. The doctors did studies to push glucose into the cells with insulin, and the studies were negative. the infusion of glucose and insulin during heart failure did not lead to improved outcomes. So that was just kind of thrown out the window. And now that it's pretty widely known that the heart uses more ketones when it's failing than when it's non-failing, there's this reluctance to say, well, it's because ketones are good for the heart, right? If you knew sugar was good, ketones and fat are bad, you would reluctantly show that ketones are increased, and then you would say something like this: whether this change is adaptive or maladaptive is not known. No, fatty acids and ketones are good for the heart. It's pretty clear. It's just not being accepted by people in the old paradigm, because that would basically mean that you're changing the ways, and the research that you've done was basically off base. The last bullet here, which is really fascinating. Remember, we've come through a time when doctors think medications are the only way to deal with things. There's a new medication class called an SGLT2 inhibitor that certainly reduces heart failure readmission rates. It's used widely by cardiologists today. But there's an unintended consequence in some people, that they get ketoacidosis and can be actually have life-threatening hospitalizations as a result of it. But the current thinking is the possible mechanism is ketosis, written by a researcher who knows nothing about the nutritional ketosis paradigm. This is the Hattori paper. Basically is saying that maybe these drugs work because they give ketones, and ketones are good for the heart. So there's a pharmacological ketosis happening today from these sorts of medications. What I use and what I talk about is nutritional ketosis, meaning just changing the food, you can get ketones and have the benefits of ketones around.